Leslie Marshall is a radio talk show host with a passion for health care. And Jim Martin leads the 60 Plus Association. Thank you both for joining us. Jim, I wanted to start with you. You know, it's one of these things, it's NIMBA, not in my backyard. It's kind of that argument. No one wants their benefits. No one wants to make sacrifices. Big Pharma doesn't. Doctors don't. Taxpayers don't. You senior citizens don't. But the reality is we've got to get these healthcare costs under control in this country, or this country is going to need a bailout. You guys got to take some off the shoulder as well, I'm sorry to say. And my parents are also on Social Security, so I feel it as well.
Well, true. And let me say this. Healthcare reform needs to be accomplished. But we say at 60 Plus, seniors do, first do no harm to a system that works well. 80-some% or more are pretty well satisfied. We have to work on it, though, obviously. And there are lots of ways to do that, and I'm sure we'll get into that. But let me tell you something. On these massive Medicare cuts, I've been warning seniors for over 6 months that they were going to be faced with at least $500 billion, $500 billion in cuts to Medicare. I've been vilified for 6 months. Today, I feel vindicated because the CBO director, Douglas Elmendorf, a Democrat, not a Republican, appointed by Speaker Pelosi, he confirmed that these are the cuts. The Associated Press has been calling them cuts in that magnitude, so has the New York Times. We seniors have paid into this system for 44 years. We've paid our dues. We cannot take these types of cuts. And you know, when they talk about Medicare Advantage, you mentioned earlier in the program, Humana has been given a gag order. That's a company out of Louisville, Kentucky, my home state. I'm not on their payroll. They've been told, don't talk about Medicare cuts to Medicare Advantage.
Leslie?
But, incidentally, the AARP is offering the same plans. They're not being told the same thing. Why? They made over $600 million last year in royalties off the benefits that they offer to seniors.
See, and Leslie, that's just it. I can't tell who I'm supposed to be listening to. The liberals don't care about poor people health care, or they'd be doing something about it and not sitting here coming up with all these scams for pharma and health insurance, etc. And obviously the conservatives don't care about rule of law, and they don't care about personal accountability, because otherwise they wouldn't be sitting here explaining why Medicare and Medicaid are so important. Where do you stand on all of this? I've had a hard time trying to figure out your stance. I feel like it's sort of like mine. I don't know where I stand. I just know I don't want the Republicans or Democrats writing this bill.
Well, I disagree because, unfortunately, we elected them, guys, and we have to trust them to write the bill, what bill they come up with and whether I support it or not, because there are 10 now when you add Backus's plan. You know, that's key. But when you say, you know, the liberals don't care about poor people, not true. And you know, to generalize that way, certainly there are varying opinions, as there are varying plans in both the Democrats and in both Democrat and Republican Party. And I am a liberal Democrat, and my tax exemptions for charity will certainly show that I care about those poor people. And my husband, as a surgeon's many pro bono surgeries, et cetera, will show that. But that aside, let's talk about Medicare. You know, the reality is when we discuss cuts, for the past 4, dare I say 6 years, Medicare constantly cuts. But what we don't talk about is where are those cuts? The individual plan holders that have played into the plan for many years, 40, 45 years. And hey, lucky you, because when I'm 65, it ain't going to be here most likely, and I've paid into it all these years. But that aside, the cuts actually come in reimbursements to to the physicians. The reimbursements to the physicians. You want to look it up? An orthopedic surgeon gets paid $18.36 to spend 45 minutes with a senior. That's not possible, folks.
Leslie, hello.
Let her finish her point.
Oh, wow. She finished her point.
Thank you. Let the lady finish, and the lady cuts in for me. Thank you.
Leslie, you're a doctor, okay? You're a doctor in, I don't care, Mississippi.
No, my husband's a physician.
Whatever. Your husband is getting his Medicare repayment, the reimbursements cut. How long before he says, forget it? You got Medicare. I'm not seeing you if you have Medicare. How are you going to get around that, Leslie? There's no way around it. And that's the one leap that a liberal Dems were going to tell you how this is going to work. And they can't answer that question. If a doctor doesn't take Medicare, doesn't want to take a Medicare patient, what do we do with all those people?
Well, first of all, I don't disagree with you regarding the fact that the doctors will not physically be able to see a patient for 5 cents. I mean, you have to keep the lights on, the phones ringing, and pay your grossly high malpractice insurance. But there's one of the issues. If you don't have balance on all the areas of health care, you can't just isolate Medicare. Medicare is a part of health care reform and has to be. Medicare is a system that's been working, but it's broken. And healthcare is broken. And whether you want to call it reform or fix or repair, which I prefer the wording on, Medicare has to be a part of that. You know what? Well, somebody's going to have to give. And that doesn't mean we attack our seniors, and that doesn't mean we leave them dying in the streets. And I don't think that the United States will do that.
Why don't we give Jim the last word here? Jim, you had mentioned about the AARP. I know there's been a lot of criticism with the AARP. But my thinking is, don't you want private companies like this and private insurers, rather than move it over to private companies so we don't have this government-run any type of program?
Well, the fact is, you're going to take the subsidies that goes now to Medicare Advantage from these private insurers, and it's going to go to Medicare Advantage run by AARP. Look, the AARP is a huge insurance conglomerate. They sell insurance, life insurance, health insurance, cancer insurance, automobile insurance. Follow the money. Watch where the money goes. They'll be left standing, the giant in the field, and all these little insurers will be out in the cold.
Jim Martin, we have to leave it right there. Leslie Marshall, thank you very much. With a big debate.
Thanks,
we can